Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about the physiotherapy management in cerebral palsy patient. Now in previous video I have explained clearly about cerebral palsy clearly. Now in this video detailed about physiotherapy management, physiotherapy treatment in that patients. Okay, I am giving the link also in description previous video. Once check the video and see this video, you'll understand this topic clearly. Now we'll see the physiotherapy management. Firstly, lifting and carrying. How to lift the patient and how to carry the patient. The therapist need to instruct the patients, or if there is any caregivers, to carry the child in a special way to not to prevent worsening, means increasing of deformity. We must suggest the position, correct position. What are the positions? Means in lying position, in supine position, a pillow under the head or a pillow on both sides of the head and shoulders to provide in a symmetry, means in a proper way. To hold the head in a correct position, two pillows should be placed to provide in a good position. See, this is in asymmetry, this is symmetry, means we must in supine position only pillows under the head or both sides to provide symmetry. You understood? Next, in the prone position, see, next in the prone position, children are often more symmetrical in this position only. But a prone wedge board, this is a wedge board in physiotherapy, is used to raise the upper torso of the floor, so that they use their hands to stabilize and head to extend. Okay. Now W sitting. This is W sitting. This position is used to be avoided. Children mostly use this position only to sit because of the reinforcement of the flexion and adduction and internal rotation position of the hip. This position should be avoided, okay, in children. Next one, this is the in standing position. This is the best position. Standing prevents the equinus deformity of the ankle. While standing, the hip and the knees should be extended, means in a fixed means they should not flex hip or shoulder knees, and slightly external rotation and abduction of knees, means away from the knees. The knees should be straight and feet should be plantigrade, means in equal position. Now types. In this types, what are the types? Means in floor sitting there are four types. First one is a corner sitting. In this corner sitting, the child sits supporting the back with a corner. In the corner of the wall, they'll sit a chair or sofa with legs supported by gaiters. Gaiters means, see, this is the cloth or leather type which covering from the instep to above ankle. Okay. In India, there is a little furniture in many houses, and all activities are on the floor. Okay, they can do. The child is given in a corner floor seat with legs extended. Next, side sitting. See, side sitting should be encouraged, and long sitting. Next, W sitting. Okay, it is rarely prescribed. Next, chair sitting. Chair sitting. The correct position in chair sitting is head upright, means looking forward, and the spine curve supported. The person's weight distributed eventually through the buttocks. Okay, in both buttocks weight is distributed, and thighs. The knees at 90 degrees flexion and the floor plantigrade. Now stages in prone development. How to develop from prone to sitting, standing. Okay. Next, prone position placements. Head control, raising the head in prone, raising the head in prone with postural fixation, means we have to fix the fixation, holding it steady. Next, turning the head from side to side counter position, raising the upper torso. Upper torso also means this is the head, this is the trunk, upper torso with head, and taking weight on the forearm, raising the upper torso. So there is a pre-lunge of crawling. In this they can crawl also. Okay. Now supine development. This head is stabilized. The head is stabilized with respect to the shoulder girdle. The head is stabilized. Next follows the shoulder girdle, which is postural fixed with related to the head and pelvis. supine position. In proper normal supine position only, supine development, how to improve? The head is stabilized with respect to shoulder and girdle. Next, the shoulder girdle, which is posturally fixed and related to head and pelvis. Next, postural fixation of pelvis with respect to shoulder girdle and lower limbs, raising to sit and raise to stand. Okay, now development of sitting. In supine rise to sitting, means in supine to sitting. Okay, from 0 to 6 months normal development level, help the child to develop head control firstly. Next, from 6 to 10 months normal development level, help the child comes to sit on his own. Okay, after it has attained fair head control. After head control, we must ask them to sit by his own only and develop the balance and saving reactions. Of course, the development age is more important than the chronological age. Sitting is trained once the child has attained fair head control. Okay, after head control, sitting is trained and development, balance and saving reactions. This child is given exercises like pull to sit. We must pull to sit and sitting with counter positions. Okay, sitting with counter positions, side lying to sit. Okay, spinal extension exercise. These all must be done by the physiotherapist. Okay, I hope you understood this topic. Notes also I have given in the description box. Once check it out. Thank you.